Welcome back to part two of the Voices of Healthcare Equity, where we are continuing our conversation with Dr. Nondumiso Makhunga Stevenson. I want to pick up on something you said about South African doctors, how they are courageous and they are politically active, and how that political activity translates into speaking to the Ministry of Health and getting things done and having an overall impact on the healthcare system. I think people misunderstand courage. And I don't think you misunderstand courage, but I just want to say for our audience, courage is not the absence of fear. Courage is standing in the fear and choosing to do something else, something anyway, because the outcome is important and because what you're trying to see on the other side of that fear is important. And as doctors, we have a privileged position in society. And that comes with a responsibility for ourselves, but we are ingrained from a very early time in our training with a fiduciary sense of responsibility. That is rare. There is no other profession that takes a fiduciary oath that their whole profession is based on doing what's best for the other person and not yourself. And we embrace that every single day. During the AIDS epidemic, the unknown, could I get this from saliva? Could I get this from blood? Is just being around this patient going to kill me? Well, I have a fiduciary responsibility to the patient, and I'm going to do it anyway. During COVID, how can I get this? I don't know how I can get this, but I'm going to show up because I mean, it's not a law. You can't throw a doctor in jail for not doing this work. They don't do it because there's somebody forcing them to do it. They do it because that fiduciary sense of responsibility to the person that comes to you for help as a medical professional says it is what you should do. And those two things together make us very courageous when it comes to risking our own lives and our families' lives. But I don't think we have fully picked up the mantle of using that courage to think outside of the moment, but in the future to making a difference. What this requires is a little bit of faith and future vision that I'm going to do something today and it's not going to make a difference today, but it's going to make a difference 10 years from now.
Absolutely, absolutely. And you know, the responsibility that we have towards our patients, in my experience, I have seen that in almost every single doctor that I've worked with. And coming to the United States, I shared recently with a colleague in South Africa because she was asking me about American doctors, how are they? And I said, you know what? We are all going through the same. But what I'm seeing is that same sense of service. How do I serve my patients? How do I save lives? How do I show up for my patients the best way that I can? And I recently met a doctor in Rwanda who said something that really, really touched me around that same topic. And he said, he's a medical oncologist. He also works in a resource limited environment, but he every day wakes up thinking about the privilege that it is to do exactly as you said, to be in service to another human being, to wake up and say, today I'm going to make sure that I'm going to be with this patient, even though I know I may lose the patient because he's a medical oncologist and, it's a challenging environment in terms of, mortality and so forth. But in the time that this patient is with me, I'm going to do the very best that I can, and I'm going to put myself out there. And I see that common thread, whether you are in South Africa, you are in the United States, you are in Sierra Leone, in Kenya, in Tanzania, I see that common thread amongst doctors, those that see medicine as a calling, that you are in service to another human being. And that's the most satisfying and most fulfilling place to be as a person, if you consider medicine to be your calling. So it's really something that I also share with young doctors as well, about the challenges that they are faced with, because the healthcare landscape is changing and has been changing very rapidly. From the time that you start medical school to the time that you finish, the changes that are happening outside in the structure of the health system are moving very, very fast. By the time you finish medical school, it's not the same place that you're going to be working. It's not the same environment that you're going to be working from when you started. So we have to bear in mind what is at the core and the foundation of your attitude and your drive, right? Why did you even decide to be a doctor? And if you lose that responsibility, you become really ineffective as an ally. I feel you have to have a large degree of that empathy to be able to show up for somebody else. You have to, as you say, have that sense of responsibility to be able to show up for somebody else that without pay. Without pay. And that's what we did during COVID. That's exactly what doctors did during COVID.
And I would just want to say to our audience, those that are not medical professionals or are young medical professionals, it's not all pain. We do a lot of challenging things. Becoming the road to a doctor is filled with challenge, but also incredibly rewarding. At the end of the day, when your time is up, the things you reflect on are the things that you did that were the most impactful. And what a privilege that we get to go into work, wherever you work, maybe you work from home, and really have a life-changing impact on somebody every day. That is an incredible privilege that a vast majority of the working world does not get. And in the end, we're humans, and it's human connection that makes us feel alive, makes us feel rewarded, and that gives us energy. So I just say there's lots and lots of challenges. I won't say there aren't challenges, lots and lots and lots. But remember, it comes with great rewards, and it's a great privilege as well. Thank you. Great. I love your insights and the conversation so far. Let's talk a little bit about the work that you have done. You have worked in several countries on the African continent over your career thus far. There's much of your career left to go. What have you seen are the greatest or the most common healthcare needs and inequities that have come up in your work and that still exist today?
Yes, I started really my journey to global health, fortunately starting off with some PEPFAR-funded programs, PEPFAR and USAID, CDC, Bill and Melinda Gates Foundation, as you mentioned, have been a big part of my professional career early on in HIV prevention programs, which is where I primarily worked. I was also fortunate to work not only for local non-governmental organizations, but progressively working for international organizations. And that really opened many doors for me in terms of extending myself and working in programs outside of South Africa. And of course, I got to appreciate the local nuances in each country. Although, some of the programs or all of the programs might have similar elements, you would find that how the implementation happens in each country is going to be completely different. And so one learns, I don't want to say the hard way, but yes, the hard way when all your initial ideas are rejected because you're coming with this South African prism, thinking that things are going to work out the way that they work in South Africa, only to find that they are completely different just across the border in Swaziland or rather in Eswatini or Botswana or Zimbabwe, is completely different. And so what might work there at home is completely different. And the health system is different. The needs are different. The people are different. But also there are unwritten rules in a country. There's a certain way of speaking, There's a certain way of engaging with all the stakeholders that you cannot read in a book. And that's where the value of partnerships and local collaborations becomes very, very important. You talked about the interconnectedness, and that's where it really, really helps to be able to form those relationships, those professional relationships and bonds with your colleagues in those countries, with non-governmental organizations in those countries. Understand the government officials, what are their priorities, what are their funding structures, and also who are the other partners, in each country who would have gone through similar processes also, and maybe also other international organizations. So it is a very humbling beginning if you don't have an open-minded approach, and if you think you are coming with all the answers. So that is essentially where I started. And I did that for many, many years, I think almost more than 10 years though. And then pivoted back to clinical medicine as a general practitioner. And in clinical medicine, I was, again, in a very paradoxical situation where I'm working in an affluent suburb as a general practitioner, and 2 to 3 times a week in the mornings, I'm going to the inner city to work with people who inject drugs and people who are unhoused, and providing clinical services there, and going into abandoned buildings and shooting galleries. So seeing also another side of the same South Africa. So that I did for some time, and again pivoted to clinical research. And at that time, the research center was based in a location, so really felt the right place for me to be, because it was in the township, and I thoroughly enjoyed that because it really spoke to my other training as a clinical epidemiologist. I did my Master of Science in clinical epidemiology, and we were doing a lot of vaccine trials as an investigator there. So I thoroughly enjoyed that experience, and like with many people, that was a jumping point for me to corporate. And I joined a pharmaceutical company as a medical advisor, and later as a regional medical lead for the global health unit. So my journey has included, I haven't shared all of it with you, but I've done occupational health, I've done hospital management, and all of it has really served me very well to where I am at the moment, moving from South Africa to the United States as a what you call a physician coach, because all of that experience, whether it's as a clinician in a solo practice or a group practice, in management, at an executive level, all of that has become very, very helpful in my coaching and in being able to relate to the challenges that doctors have, especially in non-clinical roles, which tend to be a little bit uncomfortable for us because our medical degrees don't really prepare us, I feel, adequately to position ourselves for those clinical roles in terms of skills or just in terms of understanding what they are about. So that is basically where I am now, and that is how you and I met in terms of just trying to build the coaching practice and engage with doctors locally and still with doctors in South Africa and the continent.
We're going to get to the coaching in a minute. The value of coaching for physicians particularly cannot be understated. I myself have been coached, continue to be actively have a coach, and also coach others. But before we pivot, we're going to pivot to the coaching in a minute. I want to just revisit something you said about your career and the things you did around HIV prevention and the ability to be humble and to listen and learn and not think you have the answers. A couple of things come to mind for me, especially as a new doctor. I can see how you have to learn that, because at least in American medical education, the training is very much focused on you actually have to know the answers and you're supposed to know the answers to everything. And you're not ever allowed to say, I don't know, I'm going to look it up, talk to other colleagues and figure it out. So that definitely creates a bias coming out as a young doctor that you would have to overcome. But I also think about how you were able to enter and experience the parts of society that we keep hidden and silent, working with the unhoused, people that inject drugs, sex workers, and why, as difficult as that is, why it's so very important not to ignore and hide these populations, but instead to learn about them and embrace them, especially when you're talking about something like an infectious disease.
Wow, that is a conversation that is so close to my heart, because the period that I worked with key populations, I will say it was akin to, how you get that transformation when you have been coached, Kim, where you feel I have grown as an individual. That is exactly how it was. And I was receiving them, and learning from people who, as you say, many doctors would probably think they know better than them. And you realize that you have to open yourself up to that growth, starting with a basic conversation about drugs. What are the street names for drugs, right? Because we know the chemical names for drugs, that's what we are taught. But we don't know the street names, So something as simple as street names, you have to learn, You have to learn the language that people speak. And when I worked with people who inject drugs, it was predominantly young people. So, you can't come with your technical medical language. The patient will not understand you. So you have to learn the language in order to be able to relate to them and to be relatable to them. But once you demonstrate that humility, that you're able to move from this, I know it all as a doctor and I have the answers, you start to win their trust, right? And once they believe that they can trust you, then they'll start to open up to you, and that is where your learning, your education really begins, because the education is not in our textbooks. The education is with the patient that is in front of us in real life, and that growth mindset that we always talk about. If you don't bring that into the consulting room, you are also not going to learn, you are not going to grow. So once you take that and you're able to benefit from it, you share it with other patients, you become invaluable. You add value, actually, to the entire program if it's a prevention program, because you understand the issues better, So for me, for young doctors, that would be the advice that, again, I would give them. Working with key populations can be a very transformative process, but you have to show up with a certain attitude. Somebody once asked me, but, they are criminals. I said, no, they are not criminals. They said, you didn't feel safe? I said, no, I felt very, very safe. To me, this was a patient. Yes, a lot of them had committed crimes, but then you understand fully the connection between, the disease, the addiction, and how, it happens. Nobody's born a criminal. It just doesn't happen that way. People are just born criminals, and, it doesn't happen that way. When you start to really engage with them and understand what they did, their lives, you see people in a different light, and you would do that in any practice. So if you're already coming with preformed ideas and prejudices that the patients that you're going to be seeing are criminals because they use drugs, that's already a barrier. And believe it or not, I think for doctors who come with that attitude, they don't last very long, because they just can never have that connection with the patient. The patients end up defaulting treatment. They don't open up. And Kim, you have to have that relationship with the patient where they can feel free to tell you everything that they feel they need to tell you. And that's where the patient satisfaction comes in. So yeah, it's very important, especially for young doctors. Just adjust your mindset. If you are willing to open up your heart, open your mind, and learn, you will be a lifelong learner, and you can learn from anybody, including somebody who injects drugs and lives under a bridge. They can teach you and educate you more than you think or more than you expected.
I want to make this a little bit relatable to just in general COVID, all infectious diseases where we live in the world. I think a lot of times labeling people as an outgroup is a very common psychological tactic to protect yourself from the idea that what's happening to them cannot happen to you. But that self-protection is not actually protection. It is actually makes you unsafe, because when it comes to disease, ignoring an infection, let's pretend our global population is nothing but an organism, a body, your body. If you get an infection in a place where you can hide it and you ignore it, it does not go away. It gets bigger until it's overwhelmed your immune system and either killed you or made you very ill. People do this on their own bodies. Infections in the feet. Oh, we can keep that covered up for a long time. And that leads to losing limbs. And then once you've lost the limb, it leads to other complications that changes your whole life. If you have an infection in other places that, are easy to hide, like, maybe you have diarrhea. Let's ignore that. Guess what? That can kill you. There are life-threatening diseases that can be hidden in the dark places you don't like to look, and it will kill you if you don't address it. And if you don't learn about it and you don't treat every part like it's important. So indeed, our global population is a lot like that. If you just take something and you say, well, this is easy enough to hide, it does not make it go away. It makes it worse. And I want to pivot to your wonderful coaching of other physicians. I believe physicians are a particular group of people that need ongoing coaching, and they need ongoing coaching. They will only be receptive to ongoing coaching by people that understand and have the same lived experience that they have. I have experienced attempts to coach from non-physicians and physicians, and it is not helpful to have someone that does not understand the lived experience of a physician. Tell us a little bit about what your coaching practice is about.
So it's a relatively new coaching practice, although I will say, for most doctors, I think we are engaged in coaching, whether we like it or not, whether we formalized it or not, we coach. The idea for me to really formalize this began when I was working in my last role in a pharmaceutical company. And in that role, I interacted quite a lot with medical associations and led by doctors, of course, and with doctors working in rural hospitals, in various settings. And, you start to build these relationships with them, professional relationships. They get comfortable with you. Then they start asking you questions. So how do I work in a pharmaceutical company? Should I do a master's in public health? Those types of questions. Very, very hardworking doctors, very, very committed doctors, but just made me realize that doctors want to grow professionally, especially, and we don't really emphasize enough the opportunities that our medical degree provides for us. As I said, I've managed to work in a number of different roles using my medical degree, whether it's pharma, GP practice, you name it. I've done so many. And that's how, for me, it's easy to say that it's a very, very powerful degree. I have colleagues that are in health tech now, others that are in medical communication, so many opportunities, and me realizing that most doctors that I had encountered were not aware that there is life beyond even the MPH, because that's the one that I think is familiar to us. There's so many things that you can do. So that is really where it started for me, and realizing that I can really help my colleagues through, especially their professional responsibilities. But I also came across another group of doctors, people who were very accomplished, who were leaders, bright people, bright young people. As you know, in Africa, most of our population is very young. So, but who'd accomplished a lot, when you look at it, but were now sitting in these roles and asking themselves, what's next? They were bored. They've, that feeling of being stuck, they had, and again started realizing that, okay, I've been there also. I can share my experience and how I was able to find, to find excitement again in my role. And sometimes it's just an issue of doing some introspection, a lot of self-awareness, that you have to have, and also informed by my own experience of coaching. Although I didn't have a physician coach, I found myself, when I joined the pharmaceutical sector, within 2 months, ready to pack my bags and leave because I did not understand what am I doing here. And remember, I'm coming into this role with years of experience. So I'm not new, to being a doctor, but I had just completely miscalculated, misunderstood what I thought I wanted out of the role and what it was actually able to offer me. So through the coach, you go through the same process. You look at your skills, you look at your values, you change your mindset. You ask yourself, what can I actually learn? What new skills can I learn in this environment? And as a result, by the time that I left that organization, I had grown so much. I had learned so much because of that coaching. And that's where, I understood why it was important for me to go back and help my colleagues. And I embarked on a life coaching training with an accredited institution in South Africa. Did that and basically started coaching my colleagues, and the wonderful thing about coaching, not too much unlike the patient-doctor relationship, it can be, it goes both ways. You both grow from the process. It's not a one-way process. And so that has really been something that I've been focusing on since I arrived in the US. And my main objective here is to, build my networks, interact with other doctors such as yourself, and also learn, from the other doctors. But as I mentioned to you before, I'm realizing a couple of things. One is that in terms of coaching, the United States is very much ahead compared to where I come from. Coaching is linked to, for example, to CMEs. You have many coaches. I only know of one other coach that works with doctors in South Africa. But there may be more, of course, but it's not something that seems to be as part of the experience of being a doctor as it is here. So I'm very much encouraged by that, because that tells me that even in other parts of the world, there's room for growth for coaching, and especially linking it to CMEs, because, if doctors are not fulfilled in their role, I don't know if you've had this experience, but I've had that experience where you go to a doctor as a doctor and you can just tell this person is jaded, they are not enjoying being a doctor. They are just going through the motions. Not that they are bad doctors or terrible doctors or they're not knowledgeable, but there's that spark that the doctor, you expect in a doctor, that's missing. And you see this and you recognize it as a doctor. So for me, when people that I've coached come back and say, for example, one connected with me and showed me the books he was reading, because he said, now I understand, about delegating, productivity. I set boundaries. My academic days are my academic days. I manage my patients well. I no longer just say, yes, come. You start to do that. Another one who's been procrastinating with regards to her further studies, she sends me a message, says, no, I've enrolled and, I'm moving forward. So that kind of fulfillment also, and seeing that these people that you work with, your colleagues that you work with, are happier, are more fulfilled. You automatically know that is likely to transfer also to their patient, to their colleague. If they're in a team, they will show up much more fulfilled. But I can talk and talk and talk a lot about coaching because it's something that I enjoy so much because, as I said, it's something that I grow from as well. So that's really my piece about the coaching.
Thank you for that. I think you may have a slightly skewed expectation about how popular coaching is in the United States among physicians because of the EntreMD business community having so many physician coaches. It is not actually the case that most doctors in America are accessing coaching or even understand how coaching can be helpful to them. It is very unusual, and that very glazed, dead in the eyes doctor is very common here. So there is lots of room for growth in physician coaching in the United States, as well as in South Africa or any place in the world. So, I mean, I think it is also the kind of thing that's amenable to telework and can be done all over the globe. How might our audience connect with you if they're interested in coaching or interested in your experiences?
So my email address is, and maybe I can share a little bit about the name of my business. It's called Ubuntu, UBUNTU, Doctor Coaching. I don't have a website yet, but I am on Instagram and LinkedIn and Facebook using that handle, Ubuntu Doctor Coaching. And Ubuntu, as you might know, it's a Nguni word meaning humanity, right? And that's really a very, very simple explanation of it. It has so many layers, but it speaks to interconnectedness. It speaks to acknowledging the good in another person. And it speaks to being seen and being heard by your fellow man. But as I said, people write dissertations and theses just on that word because it's such a deep and profound meaning, but essentially means that how you show up is in service to another human being and you treat another person the way that you would want to be treated. So I am on social media platforms using that name, and the email address is ubuntudoctorcoaching@gmail.com. So they can also connect with me that way.
I feel like I have learned a very important new word that speaks very deeply. Ubuntu. I love it. I appreciate you. I am very grateful to have met you, to have the honor to continue to connect and work with you, and to have you on our podcast today.
Thank you, Dr. T. It's really been, I want to say, therapeutic even to chat with you today and take you on my journey. It always, brings a little bit of reflection, self-reflection, and hopefully, takes away, or I'll take away some thoughts also about the discussions that we've had for the future and for myself going forward. So I really, really appreciate the invitation to be part of this discussion.
Thank you. Thank you so much. Please connect with Nondumiso Makhunga Stevenson at Ubuntu, UBUNTU, doctorcoaching@gmail.com. In our podcasts, we explore the vital role of collaboration between public and private enterprise backed by government support for sustainable health equity innovation. If you're a minister of health, public health officer, or a dedicated public official working to enhance healthcare access and equity, please, we want your voice also on our show. Share your valuable insights and perspectives with our audience. Contact us at Dr. T, Dr. T, at haew.org to secure your spot on the podcast. Listeners, we need your support too. Please share today's episode with a friend, leave us a review, share your thoughts. Are you interested in being a guest? Email us. Visit https://haew.org to learn more, join us, partner, or contribute. Let's amplify this conversation for a healthier and more equitable world together.